again. Today is a wonderful. Hi. Okay, good. I think I can be heard now. So I picked an Uber and then I went to this community. The Uber guy who was taking me to the market to go and see what was actually what I wanted to buy. This guy looked so he was drenching. Thank you, thank you. This guy was drenching in sweat. Hi, Jake. He was drenching in sweat. He looked tired. His face was all puffy. As a medical doctor, when I saw him, I began thinking, what is actually going wrong with this guy? He looked tired, fatigued. It's as if the world was just against him. I was so I'm a Ghanaian. I'm a Ghanaian. I was so passionate. It was the first time I was meeting someone like that. Okay. Thank you. No problem. No problem. I was so, devastated. I wanted to understand what was happening to him. I wanted to know, hi, sir, what is happening to you? I mean, I can see that you're not feeling so good. I think you should have, you know, if it's someone's car or something, you should have called off sick or, I mean, he said, no, I can't. I have 3 kids and I need to make sure they are all comfortable. I have a wife and everyone must, feel comfortable. So it's like the burden was on him to make sure the entire family feels good. Now, the reason why I asked him all these questions was because I felt he needed help. He was drenching in something that he needed someone to, bail him out from it. Now, today's topic, if you saw my thumbnail earlier, you can tell I want us to repair the kidneys. And in this video, in this live session, I'm going to take the opportunity to help us understand what the kidney does and how we can detoxify the kidney, how we can help people just like, let me use his name to be, let's say, John. If you are John on this platform, I'm sorry, but it's just a scenario, okay? It's a real life stuff, but I'm just going to use the name as, you know. Now, I told John that, John, I think you should come to the hospital. It was my first day. I've not even presented myself at the hospital. So I didn't know the routines. I didn't know how things go in the hospital. So I just asked him, "Do you have a if you come from Ghana, you would understand you need a patient card, like an ID card or something. Even though we have the national health insurance, you sometimes need the card to tell whether you can go through the process and all that. I mean, it comes with, those things. So I tried my best, and then I encouraged him that after my trip, hi, Naomi. Okay, hi. After my trip with him, he's supposed to follow me to the hospital so that he can get some attention, because his around his eyes, just like that, it was all puffy. Okay, it was puffy. His lips and his face had this round moon shape. Hi. Hi to everyone. Hi to everyone. So he had this moon shaped face, and his belly was a bit distended. His legs were all swollen. And if you touch it, you can actually see that it's pitting. I got so frustrated. And he had this face. It's as if he's tired of everything happening around him. And that was when I realized that if I don't push him to do something for himself, this was going to really cause a lot of problems to him. Imagine having 3 kids, having a wife, you need to go and come and take care of them, put food on the table on daily basis, make sure they are all feeling well. The end of the day, he got to the hospital and his dreams got shattered. You could tell from his face he didn't want to pause. He wanted to, even though he didn't have the energy, he wanted to still keep pushing, because I still remember 9th November as if it was just yesterday. I still remember it so badly as if it was just yesterday. In a similar situation, I had a friend who, just after my housemanship role, this lady passed on because of kidney failure. Whenever the kidney wants to fail, it tells you. When the kidney wants to get damaged, it tells you. It has a means of communicating something to you. And in this video, I will tell you some of these things so that immediately you see them, you try your possible best. If there is anything at all, please, please seek medical advice. Please. It's not easy. It's not something you can just joke with. It's not something you can just be like, okay, at this point, um I can do without this, I can do with that. When it gets to the stage where you have to go through dialysis, it's bitter. It's something you wouldn't wish for your worst enemy. So this man, I was reading a book from Napoleon. He said Think and Grow Rich. I was reading this book and I saw a line. It says Napoleon's definition of a military genius. His definition of a military genius was the man who can do the average thing. He can do the average thing when all those around him are going crazy. This man, the children are dependent on him, the family is dependent on him, but he didn't know he was on the verge of collapse. We want to prevent something like that. When I look at, I just came back from work. I just came back from work. When I look at something like this, it just it puts my heart to the question, what if I was the one? What if I was the one? So in this video, I'm privileged. I'm going to walk you through some of the things so that you understand the role of the kidney, what it does. Is this something you can just live without. So everyone has two kidneys, and you can find them at the back, at your back, exactly where my hands are. Below, there's a flat big bone here. Just below it, there are the two kidneys. So there is one here, there is one there. I wouldn't go too much into the anatomy. I'll tell you what you need to do. And I keep on loading more videos about the kidney. Kindly check them out when you go into my account. And if today is your first time, you can subscribe so that we continue to educate ourselves. And then you can also put me on post notification. Anytime I come on live, anytime I put videos here, you'll be able to find them. Let's get into it. Now, so if you look at the kidneys, so they are positioned like that. They have two other organs on top of them, which we call them the adrenals. But that's not what we want to talk about. We want to talk about the kidney itself. There is a very, very important part of the kidney we call the nephrons. The nephrons are responsible for the filtration of the body system. So it's just like this. Imagine as you are here now, if anything has to get into your body, it has to ask permission from the skin to enter into your body, from the mouth before it enters into your body. Just 2 days ago, to the day before today, so let's say yesterday and the day before, I really have long eyelashes. So if you can see, I have long eyelashes. So sometimes it gets uncomfortable. I tend to get, if you can see my eyes, they are very red at this point. So I tend to get some of the eyelashes grow long. Sometimes it grows and curls onto my eyeball. So on my eyeball, it keeps piercing the eyeball. So it feels very irritating. And then it turns red. You tend to, you know, move your hands on the eyes and all that, trying to take out whatever is causing this discomfort. Sometimes you tend to get what it is. So sometimes I have to put my eye in water just to move the eyeball around with the muscles so that it just clears whatever it is. Now, the permission my eye requires before it allows anything to enter is that irritation it's giving me. So this is it. Let's go back to the kidneys. Anything your kidney does, your kidney want to understand, or your body want to understand, that the kidney has to filter this particular thing. So it can be anything at all. It can be food, it can be medication. So I'm telling you some of the causes of the kidney failure. I'm telling you some of the causes of the kidney failure. So it can be food, it can be medications, as in whether herbal medication, orthodox medication, it can be any of those. It can be dehydration. It can be dehydration. Dehydration is when there is low amount of water, fluid in your circulation system, especially the systemic system. When this happens, it breaks the kidney down, because the kidney regulates or functions on blood, the blood that comes into it, and then it begins to filter. Without the blood, it cannot filter. So doing this, you should understand that the kidneys is a way of allowing things into and out of the body. Majority of the times, we tend to put in things we feel they are normal into our bodies. And that, I have videos on it. You can check them later on. But otherwise, I'll be mentioning some of them so that we make this really quick. Okay, because I will make a video, an entire video, to explain majority of these things so that we understand. But in this live, I want you to understand that the kidney is like a police for the body. It's like a police whereby what the police does is it permits, or like the immigration service, it allows people the influx and outflow of immigrants into a particular country. Now, this is what the kidney is doing. If the kidneys are failing, the kidneys are not going to permit in or out. You might be able to take in, let's say through your nostrils, through the creams you are using, perspiration and etc. Your skin will be able to accept through the food you are eating, your body will be able to take in. But the blood that has to take it to the kidney for filtration, the nephrons are damaged. In order to repair the nephrons, in order to repair the kidneys, there are things you need to follow. In the first place, I started with giving you a scenario of a patient I found the first day I started my clinical work. I mentioned that his eyes were swollen. In kidney failure, there is retention of fluid in the body. And this fluid remains in dependent areas. Look around the eyes. It's a dependent area. It's a site where it's very soft. And so when the fluid is attracting from different areas, it tends to remain over there. Look at the stomach. You may see your belly and you feel, oh, I'm growing fat, I'm growing big. No. Sometimes it's as a result of ascites. What we call ascites is because the abdomen has accumulated too much of fluids in the stomach. It's not the stomach as stomach here. In the abdomen, when I say the abdomen, we have the peritoneum cavity where the fluids go to remain there. Kindly share the live. There may be people who actually need these informations. Even if you don't need it, please let someone get this live. Let people get this live. It's very important. If you look at the number of our age, people, formerly we used to hear people in the ages of 50, 60. They were those experiencing kidney failure, they are undergoing dialysis and etc. But in our current generation, a lot of things are happening. Kindly share. Let people enjoy. Let people know that this is what we are talking about. Because to protect the kidneys, it takes you as an individual, and I'll walk you through it. Let's go back to the nephrons. The nephrons have two main blood vessels. Now, the blood vessels, one is taking the blood from the heart to the kidneys for filtration, and the other blood vessel is supposed to take the filtered blood and then send the blood out to other parts of the body because it is done what? Filtering. It is done filtering. Now that is done filtering, what has to be done? The body needs to absorb all the nutrients that the kidney has produced. The kidney has filtered, so the body needs to what? Absorb them. Now, because, and it's the same way, because the kidneys have filtered, we expect that the waste part, the waste molecules, the part that is not important, where should it go? Out of the system. It needs to go out of the system. Whilst it needs to go out, the body is also trying to find its own way. The body is trying to find its own way. So, in perspective, we expect the kidney to filter, the body absorb, and then pass on what is not necessary. This is where the problem lies. This is where the problem lies with the kidney. The things that comes in, irrespective of how it is, we tend to filter it. From childhood, everyone, each and every one of us has over 1 million nephrons in each kidneys. So let's say the kidney at the left, to your left is my right. The kidneys have over 1 million nephrons in them. If you move to the left side or to the right side, the kidneys have over 1 million nephrons in them. in our daily lifestyles, in the things we do on daily basis, the kidney keeps on or continually damages some of the nephrons on daily basis. On daily basis, some of the nephrons keep dying off. They keep dying off. They keep dying off. It's as a result of the things we do. We take medications. Sometimes we stay without drinking water. Sometimes we eat things that contain certain toxins. Sometimes we smoke, we drink alcohol. Sometimes we do things, we get infections in the course of our lifestyle. You get tonsillitis, it goes into the blood, it gets to the kidneys for filtration, and then it grabs the infection, the microorganism. You get UTI, it gets ascended into the kidneys, all right, through the bladder and the ureters, and then it ends up in the kidney. You give birth to a child, and the child has what we call either polycystic kidney failure, or the child has a blocked nephron, which means you have to stent the nephron in order to allow this child to pass urine. It's a whole lot happening. So it can be anything. Someone may ask, Doc, I don't know what caused this, but they said I have hypertension, and all of a sudden I have this kidney issue. Yes, you have hypertension, and the hypertension is actually blocking, because hypertension is pressure, excessive pressure in the blood vessel. Now, the blood vessel, I just told you that the blood vessel takes blood, the arteries take blood to where? The kidneys for filtration. Now that is the pressure has increased in the kidneys, it's going to kink, it's going to compress. That is where the pressure begins. Now, this pressure is then communicating to the kidneys that there is no blood. This kidneys then relates the information to the brain that there is no blood, there is anemia, there is dehydration. What do I do? Okay, stop filtering. Immediately it stops filtering, some of the nephrons begin to die off, because the nephrons relies on the blood. Now, let's get into some of the causes, into some of the things you will see. So there are two main things I want you to understand. There is what we call acute kidney injury. As I said, I won't go too much into the anatomy, physiology, etc. What you need to know is what I want to bring to you. So there is what we call acute kidney injury and chronic kidney injury. Talking about acute kidney injury, what is happening here is there is within, it's less than 3 months. Okay, first thing you need to know is it's less than 3 months. It's something that is happening instantly, immediately. Okay, so it's less than 3 months. Bear in mind. Now, in this instant, you tend to see some common symptoms. There is severe dehydration. Severe dehydration. You can give birth to a child today, and the child will be dehydrated, and because of this dehydration, it progresses to the kidney damaging. So no one is even safe. You have to stay hydrated. I have to stay hydrated. All of us have to stay hydrated. When we talk about severe dehydration, you can see things like the child or even an adult may be having cracked lips, especially if you are outside of Africa, where, okay, so in Africa, let me state the two points directly. In Africa, what will be happening to you is that it's tropics, so there is severe sunshine, whereby you get dehydrated as a result of inadequate moisture in the weather. Okay, there's no moisture, so you get you get dried up. If you are not drinking adequately, you get dehydration. Come to Europe, America, etc. Okay, and you would realize that especially during winter, when there is no rainfall, people find it very difficult to drink water. I once remember, I think in winter last year, what was happening to me was sometimes I had to even conscientize myself. I had to set an alarm on my phone that after every 30 minutes, I just need to sip a little bit of water because I didn't have the edge. I didn't have the conscience. I knew I wanted to do it, but the whole point is because I don't feel tired. It's not even the tired. I don't feel thirsty. So I tend to miss drinking water, staying hydrated. So severe dehydration is one of the causes. Also, we have major infections. As I was mentioning, the infection can come from your mouth, your body, bacteria, anywhere at all. So far as it gets into the blood, the possibility of it being filtered into the through the nephrons into the kidneys is super high. It can come from down there, okay, whether you is a male or female. It can come from down there. It can come from your mouth. It can come from a cut. Anywhere. The infection can get very serious. Now, heart attack. Heart attack. In heart attack, usually it has to do with the blood. It has to do with the amount of blood being pumped, especially when you have what we call complete heart block, or what we call heart block. Let me not even categorize the heart block. When you have heart block, what is happening is your heart is not pumping adequately. It's not pumping well. It's not even pumping. Sometimes it may skip beats and etc. Now, in this situation, it means there's no blood being sent to the kidney. It's going to cause severe issues. This is going to cause severe issues. You need to seek medical attention. Severe blood loss. For example, there is an accident. In the accident, someone injured the femur bone or a major part of the splenic rupture. This person will lose a lot of blood. There is something we call abdominal aortic aneurysm. When the blood vessel is a very big blood vessel, when it ruptures, the amount of blood you are going to lose is super high. So in this situation, the patient may be tipped into a kidney failure. These are acute. Drug toxicity, like certain antibiotics and NSAIDs. When I talk about NSAIDs, we take them on daily basis. That's the sad part. We take NSAIDs on daily basis because immediately someone is in pain, any form of pain at all, the next question is, will you take a pain medication? I remember a friend of mine was in her menses. She called me. She said, Sam, can I get something? No, she didn't even ask, can I get? I proposed it. Can you imagine? I proposed it. She was talking, I'm in pain, this and that and that, this and that. And I said, how about taking a pain medication? Can you just get one of the pain medications and take? And she's like, no, I don't like taking pain medications. I usually go through my menstrual cycle without pain medications, but it's very painful. I don't want to train myself to that. I'm like, whoa. I know it's very painful. I know it's very painful. But some people are able to go through it. If you're able to go through your menstrual cycle without any pain medication, give me a thumbs up down there. Give me a thumbs up. Let me know how you do it. Let me know how you do it. Put a thumbs up in the comment section. Let me understand that. Oh, you do well with your menstrual cycle. Right. And also, there is blockage, just like I mentioned with the child. When there's a blockage in the nephron, what's going to happen is the child is filtering. The kidneys are filtering, the nephrons are filtering, but it can't either come out or go in. And these happen most of the times. In acute kidney injury, these are some of the things you are going to see. These are some of the things. Hi. Oli Bruce. These are some of the things you'll be seeing. Okay. When you see that there is decreased urine, please pay attention to this. when your urine decreases, the amount of urine you pass on daily basis. I'm so tired because I went for night shift. When you realize that your amount of urine you are producing decreases, this has to inform you that there is something happening. The amount of, you can tell that you drink a 500 mils water, a cup, your cup is 500 mils of water. You drink it, but the amount of times you pee is very, very low. You can tell that you've peed about 100 or 200 mils. That is wrong. That's a problem. Also, when you see swelling, and which I told you about John having, having the swelling around the eyes and the legs, the feet. You will see that there's a swelling on your feet. Please don't wait. Don't wait. Don't wait. Don't wait. Lil Zebi, hi. Don't wait. Immediately you do that, there's going to be a lot of problems for you. Don't wait. There is confusion. In this instance, there is high levels of uremia that has passed through the blood-brain barrier. And so it is gone into your brain. Confusion sets in. There is a problem. You are always tired. You feel anemic, fatigue, malaise, shortness of breath. All these things are signs that acute kidney injury. I need to do something about it. I need to do something about it. Now, going further, let's talk about the chronic kidney injury, and then we move on a little bit to some of the things I know you are waiting for, because we need to detoxify the kidney today. I will show you ways and means to detoxify your kidneys, because that is very, very important. So if you go to the chronic kidney injury, especially people with diabetes, diabetes mellitus, especially the type 2, is the most common cause. This is because there is damage to the blood vessels, there is damage to the nephrons, there is high amount of glucose, high Bettkes. There is high levels of glucose, which is passing through the nephron. It is damaging the nephron. And so you go to the toilet, you urinate, and the doctors will see that, oh, there is high levels of glucose in your urine. If you know any pregnant woman or anyone who has gotten pregnant before, immediately the doctors see glucose, they try to find out if there is protein as well. If we see protein in your urine, it is telling us the urgency of management. We need to do something about it before it's too late. Don't sleep on protein in urine. Do not sleep on glucose in urine. These are things, that's why I said when your kidney is about to damage, it always tells you, it informs you. Your kidneys will tell you that this and that are what's happening. Get to work. Good. Hypertension. Look, this people sleep on it all the time. Very soon I'll be coming out to tell you even some of the machines you need to buy at home and all that. Look, you see hypertension. I just explained that because the blood vessel, okay, there is increased pressure in the blood vessel. That is why you are getting hypertension. And this will prevent adequate amount of blood from getting to the nephrons or the kidney to pump in order to supply to your body. There is none. There is severe hypertension. Immediately there is severe hypertension, you can tell that your organs are damaging. The organs are damaging. I told you about polycystic kidney disease. This usually comes as a result of genetic issues and all that. Familial. genetics. There is cyst on the kidney. Cyst means that there is fluid that has accumulated, but this cyst, they are in bits, tiny, tiny little cyst, and they are on top of the kidney, which is damaging the kidney gradually. And there are a lot of people with these medical conditions. Long-term medication use, this I can't overemphasize it. I can't overemphasize it. Irrespective of taking herbal medications or orthodox medications, there are a lot of people on constant medication. It's not good. Just like my friend told me, when I'm menstruating, I don't take any pain medication. Perfect. It doesn't mean that when the pain is severe, do not assort to any pain medication. But if you're on constant medication, what this does is that the medication, don't forget, I said it, everything that goes into the body goes to the kidney, filters it, and gives the body some and takes some out through our urine, through our sweat, through our feces, and all that. So any medications you are constantly taking, be it pain medication, depression medication, sleeping medication, medication for chronic diseases, pain, herbal medication, bear in mind that all these medication needs to go to the kidney for filtration. The kidney needs to break it down and send the active ingredient to the specific area. And that is the function of your kidney. It is working as the immigration officer, deciding who to get into the body and who to get out of the body. So long-term medication overuse. If you are overusing these medications, it's going to cause a lot of problems to you. Now, in this PowerPoint I have here, I'm supposed to talk about the estimated glomerular filtration. They are numbers. I can't be talking about them just like that. So what I'm going to do is, let me show you the warning signs. When you see them, please get on to something, and then I help you detoxify your kidney, then I can also go to sleep. Good. What are the warning signs? I have a video that is coming up. I've done it. I've stitched it. You can check my videos and also subscribe so that when the videos drop, you will get them. Now, if you are having edema, let's go back to my first patient. The first patient I ever saw, I met him in an Uber car. That was on the 9th of November 2021, when I was posted to a community to start my housemanship. Now, this patient had what we call edema. Edema is when there is swelling of the feet, the abdomen, the face, that is around the eyeballs. Now, this is telling you that there is fluid retention in the body. It means that the kidney has either filtered or it cannot filter. If it has filtered, then the blood or the fluid cannot come out of the body. If it hasn't filtered, then it means the blood is unable to go to the kidney. Even if it gets to the kidney, it's unable to divide or disintegrate that blood. That is what? Filtration. So the fluid stays in the body. That is why when you see someone undergoing dialysis, they can even tell you they cannot drink water in a whole week. They can't, because the little addition is just, it will enter into the gastrointestinal tract, gets into the blood and stays there. And that we don't want. So sometimes they can even live without water. Number 2, uremic frost. You know, uremic frost is just like when you have snowflakes on the body of a patient. Example, you will see some whitening tissue, whitening skin lesions around your neck, on your chest, your abdomen, your back. When you begin to see these things, Please don't hesitate to just, there are several people, they just go to the pharmacy, get themselves dermatological creams to clean, to wipe, smear them, and they feel it has to go. It won't. Sorry, I'm so tired. It won't go. It won't go. It is uremia that has accumulated in the blood. And it is the one on the skin is an information. It is telling you before uremia gets to the brain, it takes time. But when it gets to the brain, treatment is bad. The next is high blood pressure. We've talked about it. We've talked about diabetes. Protein in urine, I've mentioned it. Exhaustion, I talked about fatigue, easy fatigue, feeling anemic and all that. Acidic urine. The urine you are passing out is so acidic that it may even be giving you burning sensation down there. Sometimes you feel you are having burning sensation and you think it is a urinary tract infection, but no, it may possibly be a kidney issue. May possibly be a kidney issue. It may possibly be a kidney issue. Low vitamin D. Now, this is a very, very big issue. I need to come out and explain the vitamin D aspect of this kidney failure for people to understand. You should understand that, or you should know that irrespective of the sunlight, when it passes through the skin, when the rays, the radiation passes through the skin, it goes into the blood sends it to a junction where the kidneys needs to secrete some enzymes to break this down. The lab test, when you go to the hospital, they check, they will tell you that your vitamin D levels are high or low. Especially when you have a kidney issue, they will tell you it's low. This is the reason. The sunlight or sun rays you have received, when it gets into your body, it is in an inactive form. Let me come again. It's inactive. The vitamin D your body has received is inactive. So irrespective of the sunlight you are getting, you can stay under the sun, be burned. It's inactive. Now, you require the kidneys to provide the enzyme it requires to break down the inactive, make it into an active form. Are you with me? If you are with me, give me a thumbs up. Just give me a thumbs up. Okay, I can see some people showing me love. It means that if the kidney is failed, irrespective of the amount of sunlight you receive, you won't get vitamin D. So back at work, I remember my consultant. I'm so tired. I remember my consultant who would definitely make a cocktail. There will be vitamin D, calcium in some of the medications. And you need vitamin M, you need K2, vitamin K2, in order to break the calcifications. Right. So that is what it is. Now let's try to detoxify the kidneys. Let's detoxify the kidney. In detoxifying the kidney, there are a few things you need to understand. There are certain foods you can eat to help you build up the immunity of the kidney. And the first one is leafy greens. You can take note of them. If you are taking green vegetables, bear in mind you are helping the kidneys. The other one is asparagus. Asparagus reduces the acidity of the blood. So whenever you are taking the asparagus, it helps, all right? The asparagus helps to neutralize the acid levels in the blood system. Don't forget, when your kidneys are failing, your body becomes acidic, more acidic. So that is what you do. The next one is kale. K for kidneys. Kale. Kale. Now, what kale does is that it is kidney protective. Kidney protective. And then we have celery. With this, I want you to start drinking it, blend it, use it for everything. Celery. Celery is the detoxifying agent for the kidney. Celery is the detoxifying agent for the kidney. Now, I also want you to encourage yourself to take in more fish, seafood, and some meat. People think taking meat is going to crash the kidney. Taking more meat is what crashes it, because the protein is going to break down, form amino acids, and then tend to remain in circulation, which we don't want it. We don't want it that way. I hope all these informations are very helpful to you. I'm going to get back to you again with a different video, but I'm going to keep this video as well so that anyone who needs it may be able to come for it. This is how to detoxify the kidney. This is how, if your kidney is damaged, you can resurrect your kidneys. If the EGFR, which is the estimated glomerular filtration rate, I'll be making a video in my videos. You can go there and check them out. When your kidneys are less than 15, when your kidneys or your EGFR, the function of the glomerular filtration, when it's less than 15, there are certain foods you don't need to take. And I've made a video about it. Things like spinach. I know if you live outside your country, there are a lot of times you want to be taking spinach. You use spinach for a lot of the foods. I remember in Ghana, we have something we call kontomire. Yes, kontomire. It's a green vegetable. It's like cocoyam leaf. Yes. We use it for a lot of delicious foods. So when you travel outside and you are not getting it, you might want to go in for a spinach. Now, if you have an estimated glomerular filtration rate, or you have a kidney issue and you are taking spinach, please be warned. Please be warned, you are going to get kidney stones. Please be warned, because it contains high levels of oxalate. You will get kidney stones. I hope this live has been helpful. I hope you've been able to learn something from it. I hope you'll be able to share it and let others also enjoy this live. Thank you. Bye.